Good evening, friends. I'm welcoming Dr. Arnab, who had scored a AML, the AIIMS meritless rank of 6, and he had a CML rank of 23, and he had performed so well in phase 2. That is a major reason why he had a huge jump of rank. And Arnab, welcome to the interview.
Yeah. Thank you
And
so much, sir. Thank you so much, and thank you everyone, and good evening, sir.
Good evening. And actually, I still remember that you keep on messaging me in between through the Facebook Messenger, like how to prepare and what all things you should read. And then you were telling that you had a good, relatively good NEET rank. So if you are not getting a NA, you will go to NEET. And
Yes,
right
sir.
now you have scored rank number 6.
Yes,
So
sir.
you have cracked it, and
Yes, sir.
so congrats once again, and congrats on. And we had never had a meeting previously. You used to keep on messaging me, and we used to talk through the Facebook, but never met. So nice to
Yes.
meet you, and
Yeah,
nice to
yeah.
talk with you.
Nice to meet you too, sir. And this is the first time I'm doing a one-to-one. I had the chance of meeting a one-to-one, and I feel really blessed, sir, to meet you this one-to-one this time.
Nothing like that, man. Actually, we are actually happy and proud to have a meeting with you also. And I'll give a brief introduction of Arnab. Arnab is actually he's from Kolkata, right? And
Yes, sir.
he has done his MBBS from Kolkata Medical College, and then he did his MD from famous Grant Medical College, and he passed out the course in July 2022, right?
Yes, sir.
Yeah. And how was your plan? Whether you were aiming for INI or your plan for NEET, what was your primary plan when you were preparing? And when did you start it?
So actually, at the first go, I did not plan for any super specialty exam as such. So in the first go, my target was to read medicine properly and to know medicine properly, and all those things happened just in view to treat my patients better. Whoever patients they are getting admitted in my wards, my target was to treat those patients better, to present my round in a better way to my seniors and my professors. And so I had this inspiration of going back in my hostel and reading up that topic, whatever the patient presented with. So knowing that disease and whatever all forms that disease can present and the possible treatment options. So in this way, I entered into the medicine. So my first year was very hectic over there because most of the times I couldn't have the time to read at all in the first year. Then during my second year, the COVID came, and we got some free time during our quarantine times. So although I cannot say that I used up that quarantine time quite effectively because I was in the second year honeymoon period. So after that, during the third year, so I used to see these topics, and I used to then one good thing I did is that I subscribed to this Marrow platform, and then my study took quite a systematic pathway. To I started from one topic, from one chapter to another chapter, and doing this topics going these topics from one subspecialty to another subspecialty. And because in those times Marrow didn't provide the handwritten notes, so I had to see the videos, and so that I don't forget those points, I had to make my own handwritten notes in those times. So before going to my ward, before going to my rounds, if the same disease presents with some different patient, I just have a look over those notes, and so it made me confident in medicine first at the first go. Then afterwards, I felt somewhat inspired in neurology in some way or other, so I just went for it. And during the last phase of my preparation of my this final year, so there was one INI exam coming up. So I felt that if I have done this much of neurology studies, so why not give one chance to this INI exam? So I just went for that INI exam in July 2022. So in that exam, my rank was around 67. So it was nowhere in the selection part of this premier institute. So, but I thought that okay, my preparation was in a correct way, and at that time I was not even done with my final year examination as well. So after that, I had given my final year exam, and then after that NEET came. So this year's NEET pattern was totally the first time that it includes all the subspecialties with equal importance. So I had to deal with all the subspecialties also. And then after the NEET, there was that inside insect that was biting, that I had that 67 rank, which I could have improved at that time. So why not give it a second chance? And the second chance I gave, and the result yielded, sir.
you rocked it. And actually, among the this is I think the fourth interview I'm doing. And all the candidates has different perspective
Yes, sir.
to the studies and everything. Actually, it is really interesting to sit in the other end and listen to all those things. And
Yes,
and you are telling a perspective is totally different from other candidates, and which actually I liked it also. Like you are telling that you want to learn medicine and you started going through Marrow from second year in a perspective of learning medicine better. That means that you have the natural interest towards the subject that is medicine, general
yes, sir.
medicine. So
Yes, sir.
I just want to ask a different question, which I never asked to other candidates. Like, how did you started watching Marrow from second year? So how did it help during your wards or your case presentations, or anyway it helped in your academics other than your entrance?
Yes, sir. See, sir, I when I subscribed to Marrow, it was not my target to. It was not the only target of mine to clear the entrance examination. So clearing entrance examinations were not the sole target of mine. I just wanted to learn the subject at the first go. And for me, sir, with the hectic daily ward rounds and to continue with those two voluminous books of Harrison and going from the first line to the last line and then going through each and every tables, it was very hectic for me, sir. And it would be very easy for me if someone comes, some expert comes, and this, and he or she gives me an explanation in a very lucid way so that I can understand it at the first go before even a single word from Harrison. So before it, there are so many chapters and there are so many topics in so many subspecialties where I have not read a single word from Harrison. Before that, I just went through the Marrow videos and made my concepts clear. And in between, where I thought that my concept is lacking or something needs to be added up, then I resorted to some other sources as well. So my primary source was your videos and sir other faculties videos, sir. And because at that time I didn't Marrow didn't provide, as I said, Marrow didn't provide this handwritten notes, so I had to make my own notes. So it was quite a tedious at those times. I had to make my handwritten notes, and but it was worth it, sir, because it helped me in revision quite well, sir.
And I want to tell everyone out there, all the friends, like all the students and friends, like this is something which I was keep on telling, even Ragesh sir was telling me, Shan sir was telling, like when you're doing your residency for 3 years, enjoy the residency and don't put any targets like I have to pass this and make a DM or something. You have to enjoy the MD medicine. Remaining things will naturally flow towards you, like because you have the love and passion towards medicine. That is a major reason. I hope that is a major reason why you had a good performance in the phase 2, because phase 2 is more clinical, more
Yes, sir.
the concept oriented rather than simple MCQs. So I
Yes,
think
sir.
that is the part which helped you a lot during phase 2, because nobody can prepare specifically for phase 2, right?
Yes, sir. Yes, sir. Definitely, definitely. And I must say, sir, I still love medicine. I still love other subspecialties like nephrology, like cardiology, and definitely, I should say that I would miss out all those things, and I would miss out the stetho touch that I love this much. But sir, this love for neurology was something that beat all of them. So I had to go in depth of the neurology. So
And
that's why it
actually,
was.
I don't know whether because I love neurology that much because of that, whether I feel like that. But I feel like if you love medicine, neurology is the best subject to take, because you will see all the general medicine stuffs in neurology.
Yes,
You
sir.
will
Definitely,
have the
definitely.
encephalopathy, CLD, everything will come to neurology. And
Yes, sir. Yes.
it is more clinical. Among all the specialities, this is one specialty which is still now, it is not investigation based, it is deeply clinical based.
Yes, sir.
So
Yes.
that is one reason why I love neurology also. Like neurology is
Yes.
because of that is beauty of neurology.
Yes, sir.
Other specialties, anyone can get an investigation and make some, at least some nearby diagnosis. But in
Yes.
neurology, you need to sit with the patient. You should have that idea of eliciting signs and getting the proper history. That only will guide you. And seriously, I like your attitude towards medicine. I seriously loved it.
Yeah. Thank
And
you. Thank you so much. Thank you so
and
much, sir.
And how was how was you planned about you have the Marrow videos, you have the Marrow MCQ discussion, then you have the Q banks. So Q bank came recently, and Q
Yes, sir.
bank actually like the Marrow team has worked so well in the Q bank. I was going to Q
Yes.
bank question. There are some in-depth questions are there. They have worked a lot for bringing out the Q bank. So how did you feel the Q bank? How did you feel the videos, and how did you feel the MCQ sessions? So there are three
Yes.
parts are there. So
Yes. 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 So first of all, I should say
how
that
useful was it?
yeah. So first of all, I should say that when Marrow came first, it only contained the video section, sir.
Yeah,
So
yeah.
I started up with these video sections only with making my handwritten notes side by side. So in that video section, I should say that this many hours of video session that you uploaded. So it was, I should say that it was a commendable task, sir, from your side, that you sit for those long hours and you continued recording for the continuing. I don't know for how many long days, how long days you continued to record those videos, but those recorded videos are gems, sir. They are jewels and diamonds for me to understand neurology, because we had
Thank you so much.
explained all those so critical topics in such a well concept, in such a lucid way, sir. Had I been reading those Harrison's directly from Harrison's, I could not have grasped the topic that well, sir. If you are not there at that moment, sir. So this had helped me a lot, sir.
This is
And
really good, seriously.
yes, 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 sir. Definitely, I should say, sir. Not only you, sir. The other faculties' videos are also so much excellent. I loved them, sir. I loved Nissan sir's cardiology explanations. Even after seeing Nissan sir's cardiology explanation, I thought that I should not see. I thought that I don't have the need to go through Harrison's at all at those times, sir. It was such a comprehensive video that Nissan sir uploaded. And sir, also Rakesh sir, also the hepatology videos, the gastroenterology videos, everything was such a conceptual, sir. From the conceptual point, starting from conceptual point to touching every single little points that is the MCQ, that can be the probable MCQs. So it starts from a theoretical concept, and it starts from the conceptual part, and then touching the theory, the MCQ part as well, and the practical section as well in between. So it was a very wonderful experience with the video, sir. And second thing regarding MCQs, sir. In those times, I used to go through all those MCQ. I used to go through all those MCQ sessions mainly from neurology parts, sir, because I was completing the neurology section faster than the other subspecialties. So I was majorly going through the neurology, all those mini tests, those mini tests, and those grand tests, and all those things, sir. But I was missing out the Q bank that we used to have in a NEET PG preparation days, sir, because the Q bank is something that gives you an advantage over others in an exam which is totally MCQ oriented, like a NEET SS examination, sir. Sometimes it happens that we are running short of time, so we just go through the important MCQs that will actually help you in cracking your examination and fetching a good rank, sir. Even some of your videos are also MCQ based, sir. I like those videos so much. Because you said this, sir, autoimmune encephalopathies and this infection part, they are so large. So if you start learning them from A to Z, it will take a huge lot of time. So sir, your this MCQ based sessions were such an efficient that most of the questions I faced in all the NEET essays and these two INI sessions were from all this your video discussions, sir. So it was such an efficient task. And then that before, I think before 1 or 2 weeks, or 3 to 4 weeks, this NEET SS examination, this Marrow Q bank came. So I was so happy that this Marrow Q bank came at last before our NEET SS examination. And then I started solving those MCQ Q banks also, sir. It was exhaustive, and it helped me quite a lot in pointing out the important points from the NEET SS point of view. So it helped me a lot from the exam point of view. Your video is totally for a conceptual part and for practical part, and these MCQ sessions are important in focusing what are the areas to focus on before you go on for an exam like NEET SS or INICER.
And actually, like last year, like a lot of students keep on asking why the Q bank is not there. We want
Yes,
Q
sir.
bank.
Yes, sir. Even I was also asking why this Marrow is not coming up with the Q bank. We actually
Actually,
need it, sir. We did it.
even we all the faculties are keep on asking them why the Q bank is not releasing. But the thing was, they want to make the things perfect, and right now everything is there. Like we have the video, we have the MCQ section recalls, and even the Q bank. Now our mentor is almost full. Everything is there ready, and they had done it very well. Actually, Q bank team really did it very well.
Yes, yes,
So
yes.
I hope that from now onwards, the students will have a lot of advantage because they can go to QBank also. That will give you a lot of edge because
Yes, sir.
practicing MCQ also is required for cracking any exam. And
Yes, sir.
so, how was your phase two? Because you have a drastic change in your phase two. Like you perform so well in phase two. So, how was your phase two exam, and how? I mean, whether did you do any preparations? I know the things, but You can tell it. How was your preparation?
So actually, for the phase two examination at the first go, I had no clue about what to read for and how long to read for and how much time to invest for this phase two preparation and all, because I had not been any interview from AIMS point of view in ever before, sir. So it was my first interview with the AIMS authorities and AIMS professors, sir. And so, firstly, I asked you what are the major topics that I should focus on from a Viva point of view. So, then you mentioned that strokes, epilepsies, and the movement disorders. These are the major topics that you should focus on before you go towards your phase two examination, sir. So the phase two examination is really it is a non-specific section because I inquired so many people, and they said that the topics are totally random, sir.
Yeah.
They can come from any topic, sir. So, sir, basically, what they come up with in the phase two examination is that they have made cards, the display cards, and they screen share and they show the question. Either it could be a clinical presentation, or it could be some CT scans, some MRI. So you have to describe that image first, and then tell the possible diagnosis, and they will ask you about about the possible about the investigations. What will you suggest? And then the question ends up with the possible treatment options. It is the basic structure of all of the questions that I inquired and I came to know, sir. So because this time the participants are on the higher side, so they could only afford to spend 7 to 10 minutes, sir, and on an average two questions per student, sir. And sir, I was asked about two questions. The first one was a clinical case scenario, and the same question: what is the diagnosis? It was an optic nerve related question. So, what is the diagnosis? What are the investigations, and how do you treat the patient? And second one was that from cerebral venous sinus thrombosis, sir. It was a CT venogram, sir, and he has asked me for the possible investigation and treatment options, sir.
Yeah, that is what actually we were also discussing in you messaged me just telling that they can ask anything, random
Yes.
question because but the guesses are like that I was telling they may ask some clinical things, but nobody can
Yes.
expect what they are going to ask.
Yes,
So
sir. But what I did, sir, exactly what helped me, I should say, what helped me a bit in preparing for this phase two is that I collected some questions. I inquired about the previous rankers who are right now working in AIMS and all the other central institutes. So I collected some questions and I made a Q bank kind of thing, which is containing probably 10 to 20 questions, sir. So then I got to know the pattern of around which the question revolves. So I had a clear idea of what could be the possible questions coming, and then although I didn't prepare specifically for this optic nerve pathology or for this cerebral venous sinus thrombosis, but the pattern was same, sir. So I could say that it had helped me a lot.
yeah, that is what phase two is something which whatever you know, everything should come together. Like whatever entire knowledge and
Yes,
about the case, about the concepts, everything will help you to do well in a phase two. Not just you cannot prepare for phase two after the phase one result. You don't have enough time for that. The entire thing will may help you or may not help you. That all depends. Again, there is a lot of requirement of luck. That is what
yes, sir.
I don't
Yes,
know
sir.
about this year. Last year, the last candidates got hardly 1 minute or 2 minute questions,
Yes,
but
sir.
the beginning
Yes,
candidates it was more elaborate things.
yes, sir. Yes, sir.
And
Yes.
what is your plan now? You are planning to go to AIMS or you which part? What is your selection center? What do you think about?
So regarding the selection of this institution, I'm still in a dilemma, sir. Obviously, sir, AIMS Delhi was in my dream and was in anyone's dream. It should be in
Yeah.
anyone's dream, sir, to join this AIMS Delhi. It is a premier institute. It is a central institute. So, sir, I had this dream of joining this AIMS Delhi since my UG days. So, in my UG days, I tried. I could not, sir. In my NEET PG days also, I tried, but I could not, sir. So, in super specialty, this chance came, and so I was thinking about this joining this AIMS Delhi ultimately, but so many factors are there, so I should give proper consideration to all those factors, and I think I need one day or two more to decide to finally come to the point of where to join, sir. Because in my
Okay.
state also there is one good institute, IPGML also. So
Yeah.
after the NEET examination, I was almost mentally prepared to go to join there at IPGML Kolkata, sir. And at that time, I didn't think of joining in because I didn't have the belief that I could crack this examination and could be selected in AIMS Delhi, sir. But right now this happened, and so I'm in a quite dilemma, sir. So I will take
Actually,
a
You should. I think you should ask about. I mean, regarding this to your seniors, who are who is working in Delhi, and
Yes, sir.
that may help you. Anyway, your NEET rank is also good. Your AIIMS rank is also good. INA rank is also relatively good. So you will have both. Every options are available for you. You you have to decide that that you can take your time. I mean, like this sort of luck, only very few will get. You
Yeah.
work hard. It is not just luck. It is actually your hard work
Yes,
that
yes,
has
sir.
helped you to have
Yes,
this privilege.
yes. In that case, I need your guidance too, sir, in future.
Sure, man. Sure, man. You can contact me. You can contact me anytime.
Yes,
If
sir.
I know something, I will I will tell you.
Definitely,
I'll
sir.
get you.
You have been an inspiration throughout my this preparation journey, sir. And your videos were such an interesting part of this whole Marrow section that I love this your videos most. And although your videos are almost 120 or somewhat 120 in number, I have seen almost more than 100 of your videos, sir. So it was such a lucid, sir. Once I start your videos, sir, it just goes on and goes on, sir.
Thank
Not
you
only
so
your
much.
videos, sir, Nissan sir videos and Rakesh sir videos are so juicy answers, so lucid, sir. I love to see their videos
Actually,
over and over again, sir.
yeah, actually, our aim was like our entire Marrow team aim was to provide the concept and the make the things bit easier, palatable to the students rather than mugging up. So
Yes,
anybody
sir.
can do a mug up, anybody can do by heart things. But if you study something and that is after post MD, if you study something that should be there with you at least for quite a few time. And I hope that this Marrow learning may help you even when you go to your DM, when you pass it.
Yes,
Also,
sir.
this will help you. This may
Yes,
be my. I mean, our aim is to provide a base also to you.
yes, sir. Yes. I have all those handwritten notes with me, sir. I will definitely take those handwritten notes to my DM course as well, sir. It will be of good use, I believe, sir.
Thank you so much, and all the best, Arnab, and we really really awesome job, and all the best. Keep in touch,
Yes, sir. Thank you so much,
and
sir.
keep updating that where I mean which place you are choosing at the end after discussing with family everything.
Yes, sir. Yes, sir. Definitely, sir. Definitely, sir.